Hello, everyone. I'm Bob Dempsey, Chair of the Department of Neurological Surgery at UW, and we're giving an update on the COVID situation. And my first words are, everybody take a deep breath. How's everybody doing? So we've been through a lot. We can do this. We're far from finished, but we're getting good at this. And I think that's one of the most important lessons I can say. There's important new news, and that's why I thought we should do an update. This is a kind of a critical week, and there's critical changes going on. Some of the news is good and some of the news is bad. But I think on balance, a lot of it is quite predictable. And so it makes it very clear what we need to do to safely weather this storm and to make sure the people we care about, which is our patients, our families, our coworkers, and our fellow people worldwide. The first thing is we are holding our own, but there are things that we have to know about the vaccines, about masks, about viral loads, booster shots, and mutations. Um, we learned, for example, that this virus does aerosol. So it is spread through the air, and you can walk into a cloud from someone's coughing. So masks are essential, and face shields are beginning to make a comeback in the hospital setting where you may be intubating or involved in some patient care that involves respiratory secretions. That makes sense. The vaccines work, but we're learning that the levels of how well they work tends to fall over time. Now, you judge how a vaccine works in two ways. One, by looking at the antibody response. That gives you a short-term answer. Did the vaccine cause an antibody response in that person that would predict that it would resist? The other is by waiting months and seeing if the vaccinated people don't get sick while the unvaccinated people do. We know on both counts that the vaccine works. But we know with this new mutation or variant, the Delta variant, we're seeing a rise in cases, huge rise in unvaccinated, but a definite rise in vaccinated for the first time. So we began to look at the antibody which are seen in the patients. We saw a gradual decline in antibody levels over months. That's not uncommon for a vaccination. Some of these vaccinations, you basically vaccinate everybody, that the virus falls, and the fact that your antibodies fall over time and you may need a booster is not too surprising. Others, it falls more quickly. This is intermediate. So we're beginning to talk about viruses, and as I show you some of the numbers, we'll see why that boosters may be important. We know that as we look at antibodies, we're learning a lot about adults and children. Because when we started these trials, which I predict will be very important to end this pandemic, about can we safely vaccinate children, we discovered that even a small dose of the antigen causes a very rip-roaring response in children. In other words, their immune systems are that much better than ours, which is why the infection for the first year did not seem to involve children at all. I think part of that is because we weren't testing a lot of children, but also because they weren't getting that sick. As the virus mutated to the so-called Delta variant, people are getting more exposed and more sick, and we're seeing some children get sick. But we know now why they're protected. We know now that as the antibody levels are falling in adults who are vaccinated, a booster would be reasonable. Now, that's very different than what's going on now with the third dose being given to immunocompromised patients. But because they are immunocompromised, they don't mount as good a response to the antigen, so they need the 3 shots as part of their standard vaccination. Coming later in September, they will start offering booster shots to people who have normal immune system as adults, but are 8 months from their first completion of their shots. That's what the booster is and is going to be. Thus far, we've not really changed the makeup of the booster as much as just give a repeat dose, because it still forms antibodies to the Delta variant. It's just that we need to maintain a high level. The other thing that is important about masks, and why I'm very strong on masks in public and in schools, is this concept of viral load. In other words, the Delta variant is all around us. It's all throughout the United States now, and it did that in about 6 weeks. That's because it's very easy to catch. However, if you are vaccinated and are exposed to a very small viral load because you distanced and wore a mask, you may not ever notice it. If you are exposed to a very large viral load, such as you don't wear a mask, you commingle in bars, and you're unvaccinated, that's the double whammy that makes it more certain that you will be sick or perhaps have severe consequences. So this all seems to fit. It's stuff we've learned. But I want to put up some slides just to show where we are and why this is a serious time in this pandemic. So this is what's happened in really the last difference between early June, early July to August. This curve here on the left, this slight uptick, was what I was worried about. We had gone through last year really kind of in a panic because we didn't know what was going on with levels at this rate. And then when the winter came, it rose. We had sickness, the ICU closed, the hospital closed, etc. We're not going to go back to doing that again. We are better at treating things, but we began to see an uptick again. 6 weeks later, this is where we are. On the right-hand slide, this is very similar to where we were going into the winter. So we are seeing this early, and we're seeing it entirely because there is a new, more infectious strain, the Delta variant. And the vast majority of these new cases are the unvaccinated, but not all. It definitely, if it's around enough that a non-careful vaccinated person could get ill. And that's important because we are looking at where health systems could be overwhelmed. Now, this is a very spotty outbreak. In other words, while the variant is throughout the country and gathering steam throughout the world, this whole pandemic has been hotspot after calm, after hotspot, after calm. And sometimes good things have happened. During the winter, we had a spike in Michigan, and it overwhelmed their health system. That was the Alpha variant. And rather than spreading across the lake to Wisconsin, it died out. We don't know why. The Delta has not died out, but it may mutate itself out of existence. If not, we have to vaccinate and isolate it out of existence. And that means we have to make sure it does not have available unvaccinated people to spread and to spread load. The situation is similar but not as bad in Wisconsin. Again, we're a heavily vaccinated state, but don't be too sanguine about that. Wisconsin, really only 50% are fully vaccinated. And half of your population being available to the vaccine, to the virus is more than enough to allow it to grow throughout. Indeed, we've seen even 70% vaccinated in some pockets like San Francisco is insufficient to stop this. We have to be higher, have higher levels. And we have to therefore think who is unvaccinated, and that clearly is children. So we have to think, how do we protect them and protect society? Because San Francisco and Western Arizona, a very unvaccinated area, Both have about similar outbreaks right now of the Delta variant, fueled by unvaccinated people. So 30% of your population being unvaccinated is more than enough for this to spread. Now, Dane County gives me a little bit of hope here. It is one of the most heavily vaccinated areas in the country, probably the world. And we, before vaccines were available, went through this terrible surge last winter, and we started up that way. But notice it's tailing, it's flattening a bit. And I think that's because we're aware. And therefore, it is essential that we be aware. Because believe me, this population is opening up and they're going to concerts and they're eating indoor in restaurants and things I'm not willing to do. And we have to make sure that they're as protected as possible. As we also need to open up the schools, we need to have distance and masks, and we can flatten this and we can protect. And that's going to be essential because the data clearly show that if you take fully vaccinated and unvaccinated people, some hotspots are still getting illnesses in the fully vaccinated people. That's not what's happening here in Wisconsin. In Wisconsin, we're seeing it almost exclusively in the unvaccinated. But vaccines are very good. Now, what about children? Children's cases, although there have been few relatively, are increasing. And indeed, in total, they've been 14% of the cases. The problem is we really don't know what the denominator is because we haven't tested all the children. We haven't tested everyone. So to really get a handle on this, you can see where many schools and many venues, private businesses, cruise ships, etc., have said you got to either be vaccinated or you got to show me that you've got proof of a negative test within so many hours. Travel, for example, international travel is based on that. But as are more and more private organizations, the public organizations are basically at the whim of the legislatures, which have different understandings of this in different parts of our country. Given this, however, I think it's very important that we protect children, mask separation, and as soon as possible vaccinate. I implied that we're getting data on children, and we are, and we see that we have every reason to believe the vaccines will be very effective in them. They will not be rolled out till we're sure that they're safe. And much as I hope that would be October, I expect all I can say is I hope it is in the fall, because I've heard anywhere between October and December for possible approval of vaccinating children down to age 2. Because that, I think, along with a better realization in the unvaccinated adults, will end this in the United States, but not in the world. And I think that's really important to know because what happens at this point is we have a world to be responsible for, not only because it is our responsibility, but also because pandemics start in very crowded, impoverished countries around the world and will spread new variants indefinitely until we working together put an end to it. So hotspots or outbreaks have been random. And they've just been blind luck and heavy vaccination rates that have protected people. And some unvaccinated people have been fortunate that their region has not had a hotspot, but it seems to get around to them all in time. So we must think of taking care of the whole world if we want to solve this. Schools are going to reopen, there's no question. I think that's a good thing, but they need to mask. We need to make sure that children do not have a viral load that will cause their bodies to even notice the presence of the virus because it is all around. The immunocompromised must get their third dose to be complete. And the rest of us, after 8 months of having our vaccinations, should be considered for booster shots because it does boost your antibodies again, which we feel decreases your chances of succumbing to this illness. So yeah, we must learn to handle it and to live with it. We're going to reopen, but there's not an easy way to do that because we want to give it no easy way to find its next victim. I think we can do that if we remember that our responsibilities are to each other and to the world. So the major lessons today are we have to be careful, but we do know how to handle this. We're actually much better at taking care of the sick people, by the way, because our death rates are much lower. But they're rising, and that's just by the sheer number of unvaccinated people who are exposed to this variant. And that allows it to spread to the vaccinated as well, although fewer of them get sick. And again, it will allow it to spread to the children, but even fewer get sick there. So if we're sensible and stick to exactly what we're saying, we'll be fine. Now we're going to reopen here, but we're going to reopen very sensibly. By only having 60% in at any one time, we'll be able to spread out in offices. We'll be able to see each other, work with each other, get ideas from each other, but not be too close. We'll use masks. In the OR and intubation, we'll use the shields as well because we're worried about splatter. A shield alone is not going to help you with aerosols because that comes around the shield, but not through a mask, a properly fitting mask. And we're going to be okay if we look after each other. That's my message for today. I do think this increase is quite serious, and we take it quite serious, but I do think if we actually carry out the things we put in place, we'll handle it well. So as always, I'm proud of everything you do. I thank you for all that you do. I wish you the best. I'd be happy to answer any questions you might have about the reopening, the booster shots, the different brands of shots, or the situation around the country or the world. Thanks so much.